Welcome back to Still a Part of Us. We just had a wonderful discussion and story of with Sarah, and she told the story of her son Landon and how his very incredible little life was very just makes such a big, huge impact on her life. And so I'm so grateful to be able to talk again with Sarah today about just some things that she's learned about grief and loss. And so, welcome again, Sarah.
Thank you.
As a bit of context, can you tell us exactly what happened to Landon and about when he was born, just so everybody knows kind of how long ago it was since he was born?
So Landon was born February 26th, 2021. I was 35 weeks and 5 days pregnant with him, and he was stillborn due to massive placental abruption. Um,
Yeah,
Unfortunately, like and nearly mine.
yeah. And if you get a chance, I would recommend everybody to listen to that episode because it's medically complex and it I've never heard of anything like this happening before, and I was shocked. Like you'll be just incredulous about what happened to him and also to Sarah, and like she said, like it almost cost her life as well. So it has been he was born in 2021 at the time of this recording. So it's been 3 years and you've had a couple of
Mhm.
kids since then. I'm actually a little curious first of all how the grief process has looked for you. I know that you've already stated before that grief is not linear and people grieve differently, but I'm curious as you look back how did that look for you at the beginning, very early on, and then as it's evolved with even more children and being an L&D nurse, on the exact same unit that you had your loss and almost died yourself.
The grief definitely in that first period is the toughest, from
Yeah.
leaving the hospital and leaving him there to say goodbye, and then coming home to the nursery that you had for him, and it
Yeah.
wasn't even done yet. But just I wasn't even able to like, go in that room, so I shut the door. I wasn't able to go through his clothes that I got for him until I was at least 6 months past
Yeah.
losing him. But I very, very vividly remember everything I had to just even get out of bed. I still had we still had our daughter Chloe at the time, who was 2, almost 3, who we still
Mhm.
had to take care of. So I couldn't just not do anything. But it took a very long time for me to even just get out of bed. And again, part of that too was because I did have an emergency C-section. I was in a lot of pain. There was a lot of bruising, swelling. Um, we had it upstairs and downstairs. So even just going downstairs was kind of a struggle. I
Yeah.
was trying to take it easy. But I very vividly remember Chloe was in full time daycare at that time, I want to say.
Okay.
Yeah, she was in full time daycare because I remember Daniel, my husband, dropping her off in the morning, and she would be gone all day, and then he would pick her up later. And the most I could do was come downstairs and just sit on the couch for hours. I wouldn't move. I didn't want to make anything for myself to eat. He would have to go get me something to eat or make me food because I wasn't going to do that myself.
Yeah.
And I would just sit there and cry. And all I could fixate on was wanting to be pregnant again. That's all I want. I want to be pregnant. Now I have to wait 6 months because I had a C section and I just don't want to do that. And it just took everything in me to try to feel normal. I don't even know how long it was before I even like left the house to go do something. I think it
Yeah.
was at least a few weeks where I was finally like, okay, I need to try to be a normal person. Let me put on some clothes, go to the store. I think one of the first places I went, I don't know why, but I had a dentist appointment. It was like one of the things that I had recently
Yeah.
after. And so I still went, whatever, it was scheduled. I went. And, looking back through my dental file, they had said, "Oh, it looks like you have a daughter, Chloe. She's whatever age now." And I said, "Yeah." And they had said, "Are you going to be having any more children soon?"
Oh,
And I think that I said something professional and polite. But in that moment, I was just screaming at her.
yeah.
How could you ask me something like that? I think this was I want to say it was in May, April or May. So it was a few months postpartum. I still had, a postpartum look about me. And so that really just affected me, that impacted me. I had a friend who was having a baby.
Mhm.
We were pregnant at the same time. We were both having a boy, and her son was born in May. So she was, 3 months beyond when I had Landon.
Yeah.
And I remember getting a text from her that just had a picture of her son, and she said he was born at whatever time, and I don't think she meant it maliciously at all, but in that moment, I just completely spiraled. I
Yeah.
collapsed on the floor and sobbed because your baby is here and he's perfect, and the first thing that I wake up to is a text message of your baby who's happy and healthy and mine's gone, and it was just so hard, and I just spiraled from that. And to any outside person, that's such a normal text to send. And you just wanted to send it because you're happy that your baby is here. But from my perspective, it's like earth shattering that I'm
Yeah.
reliving this all over again, and I was just a complete mess. And, so then I felt like grief kind of reset for me, because it was like
Mhm.
I would like 5 steps forward and like 20 steps back.
Yeah.
um, I couldn't go to her baby shower. It was too difficult.
Mm-mm.
I couldn't go to a first birthday party. It was too difficult.
Yeah.
So there was a lot of things I couldn't do because I felt so triggered.
Yeah.
And, one of the places that I did go, I near our old house, there's this consignment shop that I love, and I still drive there sometimes. It's about an hour drive, but I love it so much. It's
Mhm.
my favorite. Most of my closet came from there. So I went there one day just as like, okay, retail therapy has always kind of been like my me time.
Yeah.
Like I
Yeah.
like to just browse and peruse and look at stuff. And I went there one day and I was waiting to try some things on, and there was a woman standing in the line and she said, "It's really hard to dress your body when you're pregnant, huh?" And because I still had
Yeah.
a postpartum body, I still looked pregnant for a
Yeah.
while. And I don't know what I said. I think I was just like, yep, because I wasn't brave enough to say, actually,
Yeah.
I'm not
Yeah.
pregnant. I lost my son 3 months ago. Thank you for reminding me, or something like that.
Yeah.
I was never forthcoming like that or straightforward that way. But it was all these different things that felt like I'm being triggered and being triggered and being triggered. Or I would hear a song that I remember listening to when I was pregnant, and that would make me cry because I'm
Yeah.
triggered again, and all these memories. And so grief has not been linear. It has not been. I still have days where I feel like I'm right back at the beginning, and it's hard. It's just constantly working on yourself and, recognizing if you need help. And I did therapy for a while, and I still take Zoloft because I'm just not ready to come off of it yet.
Yeah.
Having had postpartum depression with Gabriel, he's 15 months today. So he's
Yeah.
15 months now. And I've been on it since I had him. So that's kind of what it's looked like. And, Daniel even has moments where it's like, he feels like he's back at the beginning too. And we have different triggers. We always felt it.
Yeah.
You're just always going through it. You're never completely over it. You just keep on going the
Yeah.
best you can.
Yeah. I my therapist when we were talking about grief, she talked about the capacity, your grief is just knocking around inside of you, and at some point in time your capacity, you as a person starts to grow, and it doesn't knock around as much so hard on the inside of you, and that's nice to know that as time goes on you change as a person, and yeah, it's never leaving you. It's there still knocking around a
Yeah.
bit and pushing the
Yeah.
buttons every so often, and yeah, triggering you when when the least you expect it, and it's rough those
Oh
times
gosh,
for
I know.
sure.
And it's those moments where you just really don't expect it and you're like, "Oh my gosh." And for me
Yeah.
being at work, some of the triggers
Oh,
are
yeah.
being in the room where I was a patient. I'm like,
Yeah.
"I don't want to be in here." This is where I had Landon, or going into the OR where I was a patient. I'm like, "I don't want to be in here," because that's our emergency OR. Like
Oh, it
that's
is,
where the
yeah, uh-huh.
emergency cases go. We try to keep that one open only for that. And we had to go back for an emergency. I don't remember what it was. I can't remember what happened to her. Her baby was fine, but it was just like, oh my gosh, and I don't want to be in here. I feel
Yeah.
so triggered, and
Yeah.
they just pop up when you don't expect it.
Yeah.
It's just somebody will say something, and you're like, oh. And I think I will say, it feels easier now that we're done having kids, and we feel like our family is complete, and we
Yeah.
know we're not going to have any more.
Yeah.
Versus still being in that phase of trying to have our
Right.
kids, and people asking us questions that are like, how could you ask me that?
Yeah.
Like, I don't know, just I can't even think like, oh, when are you gonna have more? Or are you
Yes.
guys trying? Oh, Chloe's, 4 years old now. When are you gonna have another one? And you just want to be like, I don't say something mean, but you don't. So
Yeah, I know, you never do, but you're at the same time, you're like, "It's none of your business," and you don't realize how I think until you have a loss or you struggle with fertility, you realize that's a really personal question. It's an
uh-huh.
extremely personal almost invasive because, I mean, that is referring to, somebody's sex life, I think, and,
Yeah,
what
yeah.
their body's doing, how their body is doing. Yeah, it just I feel like it's a tricky question. I never ask it anymore. So,
Yeah, it's always seemed so innocent, like, "Oh, you guys gonna have kids soon?" And
yeah,
it's
yeah,
like, you have no idea how long we've been trying to have
yeah,
kids
mhm,
or what
mhm,
we've already been through.
yeah,
So it's not an innocent question at all. And I think that unless somebody has gone through a loss or heard similar stories,
yeah,
their perspective is a little bit shifted and
mhm,
they're kind of just, they won't understand the same way that people that have gone
yeah,
through something will
yeah.
understand.
Yeah, it's crazy. Changes who you are, changes how you
Hmm.
take people. So you, just as a reminder for everybody that you were told because you had an emergency C-section, you were basically told 6 months. You cannot try to have kids for 6 months, and you guys knew for sure. Like you said specifically, as you were walking out the hospital, that you're like, "We're definitely having kids. We're gonna try
Hmm.
again. We want children, more children." And when you finally did get the okay, did you get the okay at, like, 6 months?
They didn't tell me, okay, they just I counted from 6 months, and
Okay.
I'll be honest, I started trying 3 months after because I was like, "I don't
Really?
wanna wait that long." It didn't work, of course.
Okay.
We didn't get pregnant until 8 months after we had Landon,
Okay.
so
Okay. So, you guys were still planning, did you have to do anything particular for that, pregnancy?
it was the same thing that we did for Landon, so we did time intercourse for to have Bailey, who's our 2-year-old, and, it did not work that first cycle. We had a
Yes.
miscarriage. No,
Right.
it did work the first cycle, but it was a
It
miscarriage,
right,
and
that
then the second cycle, oh, this is interesting that I didn't say in the first episode. The second cycle, it worked. Once again, I had 2 eggs, just like I did for
yeah.
Landon because they monitored that on ultrasound. And, what's interesting is one of the fertility tests that they had done on me, it's called an HSG,
Uh-huh.
which it's a test they do where they put dye through your fallopian tubes,
Mhm.
and they can see it on the ultrasound, and it tells them if your fallopian tube is blocked, which can happen, or if they're both open.
Yeah.
When they did that test, we were supposed to do it with Landon, but we got pregnant with him and like we just didn't have to worry about that. But we decided to do that test before we had baby just to make sure there was nothing else that would get
Okay.
in the way of us trying to have a baby, another baby. So they found that my my left fallopian tube was completely blocked, but the right was fine. And I was like,
Oh.
okay. Yeah, I was like, all right. They're like, it's not a big deal. Like, you have, they said basically your fallopian tubes can actually kind of like move, like to
Mhm.
pick up an egg, which I didn't know. That's
Yeah.
interesting. So, like,
I
if
didn't know
one
that
is
either.
blocked, the other
Uh-huh.
one can still pick up the egg from the other side. It wasn't
Oh,
that big a deal. So, I found that to
okay.
be interesting. But anyway, so when we did the same treatment that we did for Landon, which was the timed intercourse, the fertility pill, going back for ultrasound monitoring, they found that I once again had 2 eggs with Bailey,
Mhm.
but they were both on the side that was like I was ovulating off the side that was blocked. I'm like, well,
Oh,
then
okay.
it's not going to work
Yeah,
because
yeah.
that side is totally blocked. Okay, whatever. We'll try again next month. So I remember taking a pregnancy test at nighttime, and it was negative because I we wanted to have sushi for dinner. And I was like, I'm not going to have sushi if I'm pregnant. And so I was like, let's just take a pregnancy test and see. It was like, I don't know, 10 days after they told us that it was time to like try to get pregnant.
Yeah.
I was like, okay. So I took the test, it was negative. So I told Daniel, okay, let's order sushi and I'm having a glass of wine. So that's what I did. And then I just thought that it was not going to work because again, I had 2 eggs on the side that's blocked. It's not working. I'm negative. It's negative. We'll try next month.
Yeah.
And then the next morning, just for the heck of it, I took it in the morning because they always say take it, it's first morning urine when it's the strongest. And it was positive. And I was like, oh no, I just had
I
sushi
just
and
had sushi
wine.
and some wine.
And I FaceTime Daniel and he's at work and I was like, is there anyone around me? He's like, no. I was like, okay. The first response is positive. And he looked around again to make sure no one was there. He's like, what do you mean it's positive? I'm like, I mean it's positive. I'm pregnant. And we kind of just were like in shock, excited, but
Yeah.
in shock. And so we did again the blood work, like to make sure the hormone level is rising, and it was. We went at the 6 week mark. And I kept telling Daniel, I was like, I just have a feel. Wouldn't it be weird if it was twins because there was 2 eggs? And he's like, there was 2 eggs with Landon, and he wasn't a twin. I was like, I don't
Yeah.
know. I just feel like it's going to be twins. I don't know why I felt that. I just did. But we go to the ultrasound. Wouldn't you know? The first thing they say is that they saw 2 sacks.
Oh,
And he's like, "You have got to be kidding me." She's like, "Yeah, I'm seeing 2 sacks there." And they just kept an eye on it. The other one never became anything.
okay.
So Bailey became Bailey, and then the other one just nothing was in it. It was an empty sack.
Yeah.
But Daniel was freaking out, and I thought it was hilarious. I was like, I told you. In
Mother's
hindsight, I'm
intuition.
glad it wasn't twins. That would have been hard because we have Irish twins. Bailey and Gabriel are 11 and
Yeah.
a half months apart. That one I told in the first episode was not planned. That just happened.
Yeah.
They were both a scheduled C-section, so we had Gabriel at 37 weeks on the dot. Didn't want to go further than that,
Yeah.
and that's why their age gap is like so close. They would have been like a year and some change apart, not that much different, but um, they would have been like a year and a week instead of 11 and a half months. But
Yeah.
anyway, having Irish twins definitely is hard, and I think real twins would have been way harder because Gabriel was for sure our most difficult baby. He
Oh,
was
really?
he was tough.
Was he?
Yeah, he was tough. Yeah, it was tough there for a little bit. But, so yeah, we got pregnant with Bailey at 8 months, and she started out as a twin and then was not a twin, and she was born at 36 weeks and 5 days
Um, when
by section.
when can tell me about how you felt as you were pregnant. Were you I mean, I know that you were being watched extra because with it, right? You were being seen with
Mhm,
an
mhm.
MFM because of what
Yeah.
had happened. So, but tell me how you were
Yes.
feeling when you were pregnant with both of your kids, your last 2 kids.
So both of them, I did end up having gestational diabetes with both of them, which makes me do wonder. I probably had it with Landon too, and
Mhm.
maybe that's why I kept feeling weird. Maybe it was like a sugar imbalance. But
Yeah.
with Bailey, I felt okay. I did not feel that feeling of doom like I kept feeling
Mm.
with Landon.
Mhm.
And I just think it's so strange that I felt that with him the whole time. And I never felt that with Bailey. I never felt the same discomfort in my stomach the way I
Yeah.
felt with Landon.
Yeah.
Of course, I was uncomfortable because she was now my third baby, but
Yeah.
I didn't feel the same way that I felt with Landon. I didn't have as much anxiety as I thought that I would. There were
Oh.
times where I still went to L&D because I was panicked that
Mhm. Mhm.
I don't feel her moving very much. And, she was only like 24 weeks at that time. And the doctors all knew who I was. So they were very accommodating to me when I wanted to come to triage. Oh, and I will preface this with I had left respiratory. I
Right.
think it was after my first shift back, where after I had Landon, it was that same day that I got into nursing school or found out that I got into nursing school.
Right.
And I was in the part of the ICU where I was a patient. And that's when I was like, I can't do this anymore. So I left respiratory altogether. I just didn't pick up shifts. I would just like for months I didn't pick up and they were
Yeah.
okay with that. And then I took a job on labor and delivery as a student nurse slash tech
Oh, yeah.
while I was in school. So at this point I was working as a tech on the floor.
Okay.
So people knew who I was. I was,
Yeah.
pregnant with Bailey. So
Yeah.
I I went into L&D more often. I think I went like 3 or 4 times just to be triaged.
Yeah.
Some of that was for my own anxiety that, something feels weird in my stomach
Mhm.
and I'm worried that it's the same thing happening that happened with Landon. Or sometimes MFM sent me there because my blood pressure was trending upward and they
Mm.
wanted to make sure it wasn't preeclampsia, and it never was. And I was, again, monitored closely for gestational diabetes. I was not on insulin with Bailey. We were just diet controlled.
Gotcha.
And then when I got pregnant with Gabriel, it was not diet controlled and I had to go on
You
insulin.
did.
So
Okay. Okay.
it was the whole
Yeah.
thing. So, yeah, so I was feeling good. And even when Bailey was, when she got steroid shots, I had her on a Friday.
Mhm.
She was born at 36 weeks and 5 days because Monday was 37 weeks and one day. I didn't want to wait that long. So they were like, yeah, we'll just do a section on a Friday. Cause they're like, we can't deliver you before 37 weeks. And I said, well, 37 weeks is on a Sunday and we don't do scheduled C-sections on Sunday. So can we
Yeah.
just do it Friday? They're like, yeah, that's fine. I was like, cool.
Thank you.
So we did the steroid shot. So honestly, that whole week from 35 and 5 when I lost Landon to
Yep.
36 and 5 with Bailey, I felt like a ticking time bomb. That was my most
Mm.
anxiety provoking time of pregnancy with her, thinking like, oh my gosh, it's going to happen again. It's going to
Yeah.
happen again. So I went to MFM every single day for an NST for that whole week
Yeah.
because they
Yeah.
were okay with that. And it always looked good. There was
Mhm.
nothing, no issue. And I always, from losing Landon, I always made sure to, I had my own Doppler and I always made sure to Doppler myself before I went to an OB appointment because I couldn't stand the thought of going to an appointment and them
And
telling me there was no heartbeat.
yeah. Yeah.
I was afraid to hear that, and so I always made sure there was a heartbeat before I ever went into it.
Yeah.
And I did that with Gabriel too.
Yeah. That news that you get is just yeah, it's horrible. It's just horrible. So
Mhm.
I also wanted to point out something that is interesting that I don't think people realize unless you've had a loss is that you have you have time points that you need to get past. Like when you've had a loss, you need to get it past 35 weeks, right? And 5 days. And in order to feel like you might be okay. But then you're like, okay, but until the, I mean, I'm also going to have a level of anxiety up until they're actually born. But yeah, it's just like, okay, did I get past, we've had losses that are like
Mhm.
24 weeks. They're like, okay, I made it past 24 weeks. Okay, let's just see if you can just keep pushing it down and
Yeah.
everything. Cause we just hold our breath. There's like a level of anxiety that is just kind of always there when you're like, okay, I need
Yeah.
to get to this point and then I can get to this point. But we're just marking time, I think is a good way
It
of
is
putting it.
even in the beginning of pregnancy, it's like, okay, we have to get to 12 weeks because that's when first trimester ends. Okay, now we have to get to
Uh-huh.
24 weeks because
Yep.
that's viability. Okay, now we need to get to this because that's like late preterm. It's always marked by
Yeah.
milestones and time, levels of time and that
Yeah.
sort of thing. So, yeah.
Yeah. I know that you mentioned before that um Daniel has he was kind of the witness of what was happening to you after you lost consciousness, right?
Mhm.
Went in for surgery. I'm curious how have you guys processed the grief, and how have you navigated mourning for your son differently? Because I know it's going to be different. Everybody's different, so I'm curious
Yeah.
how that's compared to how
Yeah.
you've grieved for Landon.
I think for myself, definitely it's been more like cathartic and healing for me to talk about it. So, like
Mm-hmm.
doing this podcast and as an outlet and just spreading awareness however I can and, changing my whole career to try to honor him. I think,
Yeah.
for me, talking about it has always been the way that I kind of get through that. And for Daniel, he's more of a like when we first lost Landon, Daniel made it a point to finish his nursery. It was almost done at that point,
Hmm.
but he made it a point to finish his nursery. And every night he would just sit in his room and read and just have quiet time and like sit there and honor him. He would always just be
Really?
like, I'm in Landon's room. I'm just going to read and just sit there and be still. So he wanted to be kind of in his presence in that way. And even now, I think he's still not very he's not a person that will like really outwardly express his feelings,
Mm-hmm.
but he still has moments where he's just sitting and thinking and reminiscing. And we celebrate Landon's birthday every year, and we
Mm-hmm.
always we send off a paper lantern in the sky, and we
Oh,
always give him a cupcake and sing happy birthday. And then we also have a really beautiful garden out front. When we moved to our new house, we really wanted to do like a really big garden for him. We had a tiny one at our old house, but
yeah.
and so Daniel is always making sure that the garden looks nice and like taking care of it. And so I think in those ways, he's just kind of like, that's his grief. That's how he gets through it. That's how he
Yeah.
honors Landon. And another thing that he's done too, and he might share maybe or maybe not when he does his segment with the military, he's taken on becoming like one of the Keiko officers, which normally he's an E6. So at that, a Keiko officer is one of the casualty assistance coordinator officers,
Oh,
meaning if there's been a death,
yeah.
he's one of the ones that has to notify the family.
Oh, wow. Wow.
It's a big thing to take on.
Wow.
They normally don't do it until you're E7 or above, but
Yeah.
because of what Daniel had gone through, he really took an interest in that. And
Yeah.
I think we kind of we're similar in that way, in that kind of wants to be there for people that have gone through a loss. And even though it's hard notifying the family, I think maybe he feels some kind of peace in like being there for them in that moment, the same way
Yeah.
like me being an LND nurse has been a way for me to cope and heal, because I want to be that nurturing person and
Yeah.
be kind of like a beacon of hope however I can. And so we have, I think those are the two, like the main ways that we do it. For me,
Hmm.
it's talking about it or spreading awareness. And for him, it's sitting in solitude and just kind of thinking. And, he has moments where he'll be emotional or, we'll just say, I miss Landon today. And we know that we're just having a hard day and we just kind of hug each other and we feel it in our own times at different times.
Yeah.
So and he's like, the bond that he has with Gabriel now is just so, so, so sweet. Like
Really.
he's so good with him. And, again, I'll never know if it's because we had lost Landon before or if those fears he had of having a son have just gone away when Gabriel was born. When Gabriel was born, he was in the NICU for 5 days.
Oh. So that is
Yeah,
yeah. Yeah.
that's a big thing,
Mhm.
because Gabriel did not get the steroid shots for his lungs because I was on insulin, and with
Oh,
the steroid shots and being on insulin, it makes your blood sugars go, like, way out of whack.
yeah. Yeah.
So it was risk versus benefit, and because he was going to be born at 37 weeks, which we consider term or near
Mhm.
term,
Mhm.
they felt like he would be fine, but he really struggled with his breathing.
Okay.
He went to NICU on oxygen, and anytime we went in to see Gabriel and he was still on the oxygen, Daniel was just very triggered by that. He did not like seeing Gabriel
Yeah.
hooked up to all of these like different things. It made him really sad, and I think there was a moment when Gabriel was born where we had to take him to the ER. It's a whole thing. He was fine. He was 2 weeks old,
Okay. I was like,
um,
"Oh,
and it was just uh, anyway. He was fine, but Daniel was just so scared, and
yes."
you could really see the bond that he had with Gabriel just when he was a couple weeks old. And so I think just having his son now, I don't know if sometimes it makes it harder for him or if he's just more involved knowing that we lost a child and we
Mhm.
lost a son, and I don't know, but like their bond is just so sweet to see. And he's great with our girls too, don't get me wrong.
Yeah.
It's just different with a boy.
Yeah.
He's the only living boy that we have, and he's the baby, so very different. But
Yeah.
yeah.
And maybe it's a combination of those both kind of, I've lost my son and I wanna yeah, and I feel like I can parent a boy. You just
Yeah,
never know. It probably is a
yeah,
combination of both, so,
yeah.
and so now you have because you have your, 3 living children, Chloe was 2-ish at the time,
Yes.
um, and I'm curious how you have tried to tell your kids about Landon, or how do you talk to them about their baby brother that is no longer there?
Chloe, we haven't talked to Bailey about it yet
Mhm.
because she's still young. But with Chloe, she'll see the pictures of me pregnant with Landon, and
Mhm.
we just remind her, like, oh, Landon was in my tummy. And she'll say, Landon's in heaven now with Jesus. And I'm like, yep, Landon's in heaven. And, when we pray with the girls at night, we always pray for baby brother and thank you
Mhm.
for baby brother Landon. And so she doesn't know what happened. She just knows that I was pregnant and now she has
Yeah.
a brother in heaven, but she doesn't remember me being pregnant.
Oh, yeah, because
She,
she was
you
little,
know,
little, yeah.
she was so little. She was like two and some change. So when I came home from the hospital without a baby, it didn't phase her because she didn't understand.
Yeah.
But she still asks questions. She just doesn't. I haven't told her what happened. When she's older, I absolutely will. But
Yeah.
for now, she just knows that baby brother Landon is in heaven, but baby brother Gabriel is here.
Yeah.
So we just say we you had a baby brother and Jesus took him home.
Yeah.
So
Yeah.
that's all.
That's
Mhm.
what you can do when they're just so their understanding is not capable of, yeah, life and death and
Mhm.
those other things.
Mhm.
When you told me that you had kinda essentially switched your career from, being a
Yeah.
respiratory therapist to being an L&D nurse, I am wondering, do you feel like you're a little bit more, I don't wanna say paranoid, but kind of paranoid for the women that come there? I mean, I'm just curious of how you handle women there
Yeah.
and any things
Yeah.
that you any like, I'm not saying like you're a doomsayer or anything, but do you, like, warn them of certain things to look for? Is there anything that you do kinda differently because you're coming from a very different angle than some of your colleagues maybe?
Yeah. Yeah, I do. Specifically, and I will say this in the most layman's terms that I can because this is very much if you work in OB, you know what I'm talking about.
Uh-huh, uh-huh.
So when we are inducing a patient or even not inducing, but you're on Pitocin
Yes.
and trying to, have you contract enough to have a baby. We don't want you to have too many contractions because that's not a good thing.
Yeah.
And when you're having too many contractions, it's something that we call tachysystole. So one of the things that we can see on the monitor if a patient is having an abruption
Mhm.
is do 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 do. It's a
Oh,
tachysystole contraction pattern, and
yeah,
that's one
okay.
of the signs that they could be abrupting. It's what was happening to me in the car before it got completely stuck.
Yeah.
So when I am monitoring a patient with, who's in labor, maybe they're not on anything. There's no
Yeah.
pitocin that I can turn down to turn down their contractions. They're just contracting a lot on their own. One thing that I'll do is I always go in there and feel their belly to make sure it's not like rock hard. I make sure that
Gotcha.
there's no bleeding that's more than normal.
Yeah.
ask them, "Are you feeling all these contractions you're having?" And then kind of go from there. But whenever I see like a tachysystole pattern, especially if they're just laboring on their own with nothing, they just came in that way. I'm always like, "Oh my gosh, are they having an abruption?" And I think that's just the first place my mind goes because
Right.
that's one of the big signs of it is the tachysystole contraction pattern. So I think I'm just more mindful of it. And
Right.
when I might be a little bit less aggressive with Pitocin compared to some other nurses who will just
Mhm.
keep turning it up and up and up. And I'm like, oh, I don't want to do anything to their uterus. It's going to, cause something
Cause
bad
it.
to happen, or they're starting to have pain in their belly. My mind immediately goes to abruption when most of the time that's not what it is. But
Mhm.
I think I'm always just afraid of that patient that's going to come in looking like me, and
Yeah.
it's just all bad very quickly.
Yeah. Yeah.
So, and then I always, always, always get nervous for the patients coming in for decreased fetal movement because I'm always
Yes.
like, please let there be a heartbeat when they put them on the
Yeah.
monitor. Most of the time there is, but sometimes there isn't.
Yeah.
And I don't like those ones that come through. So there's times where I feel like I'm more nervous or on edge or afraid of
Because.
what's about to happen
Yeah.
because of what I've gone through. Yeah. And
Yeah.
because of what I know, honestly, at this point,
Yes.
I didn't know what I knew back when I was pregnant with Landon. And if I did, I would have gone into L&D, but there's no guarantee that I could have ever changed the outcome no matter what I did. I mean, to bring up a real life example, we had a patient come in who was laboring. We put her on the monitor and we could tell based on everything we were seeing that she was having an abruption.
Oh.
Baby was alive. She was having an abruption. But by the time the baby was born and the cord was cut, there was nothing. It's gone.
Oh.
And she was there and her baby was alive. So it can all change so quickly.
Yes.
There's no guarantee that even if you're in the right place that you'll
Right.
get the baby out in time. There's just
Yeah.
not,
Yeah.
So and I wouldn't have wanted my son to be, living a life with like a brain injury. I wouldn't have
Exactly.
wanted that for my child. That's very difficult and I would have blamed myself even more. So as horrible as it sounds, I will always miss having my son, but I'm also thankful that he's not living a life that I wouldn't have wanted for him,
Yeah.
if that
Yeah.
makes sense.
No, yes, completely. Like, that you put it actually really nicely is that, yeah, there's no guarantee, and it's, yeah, you wouldn't want him to be suffering in that way.
Yeah.
Um,
Yeah.
I am wondering, because this is actually a very common question that people ask, what are some things that have helped you process your grief? And I'm saying for what you've done for yourself that you feel like has been very integral, and then also anything that other people did for you, or maybe said to you that have been soothing to your soul, I guess. So
Yeah.
yeah, so anything you've
Yeah.
done and others have done to help you.
I definitely for me it's been well, therapy was huge.
Mm-hmm.
And then also just I like to write. I'm not like an artist or not an author, but I was starting to write all the details from my story that I've remembered. And I think
Yeah.
that's why they've all become so clear in my mind because I wrote out this like 7-page, book about what happened with
Yeah.
Landon. And
Mm-hmm.
the other thing too is I was starting to write like spoken word poetry and it's not done yet. It's I keep adding to it, but again, just talking about it or writing about it for me
Mm-hmm.
has always been really cathartic.
Yeah.
Um, Sharing my story on different platforms like this, just really being able to talk about it, especially working in my line of work and being able to share with patients has been actually healing for me. I think just
Yeah.
again, I keep saying it, but talking about it for me was always really healing. And then things that other people did for me, honestly, we had a meal train for like 2 months when it first happened. That was
Oh,
huge because I had to
yeah.
think about it. We had just so many people donate things, and like we had like even labor and delivery, the nurses there donated this big like basket of just all these different things, and then there was like the meal train that was signed up for,
Mhm.
and so I think just knowing that we had support in that way, it just made us feel. I mean, it's never going to change what happened, but just people couldn't think of what to do. So they're just like,
Yeah.
here's a card with a gift card to a restaurant or some money. Like, I don't know what to do to help you, but,
Yeah.
and then, that was helpful. And then Daniel's mom actually came, my mother-in-law, I'm very close with her. She came and stayed out for she stayed here for about 2 weeks,
Yeah.
just helping with Chloe and helping with my recovery and just trying to be there for us the best that she.
I think um I think it's so nice when there are people there to support you. And like you said, I really like this that you said they didn't know what to do. So they did the best they could and just was like, "Here's a card, here's something, here's a place you can
Oh,
eat, here's some food, here's a we're just gonna check in on you," and that kinda makes a lot of difference when you don't
absolutely.
know what to do.
Yeah. Just knowing you have people that are thinking about you, it does make a
Mhm.
difference even though there's nothing they could say or do, but
Yeah,
it's
yeah,
helpful in that moment for sure.
yeah.
Yeah.
And were there any things that people said or did that you're like, "That's probably not the best thing to go about doing"? I know that there was a lot of triggers and other things that people have said,
Mhm.
that we
Mhm.
mentioned earlier, but is there anything else that stands out that you're like, "Yeah, if you're trying to support somebody, maybe don't do that or don't say that"?
I always hated hearing, "Oh, I know how you feel." No, you don't. You
Yeah,
can maybe imagine how I feel, and I will always make it a point to say something other than, "I know how you feel." Like,
yeah,
I just for me, it wasn't what I wanted to hear, or, "Oh, I'm so sorry for your loss." It's nice to hear that too, but some of it just felt so generic after a while,
yeah,
and I
it
don't mean
is.
that to sound harsh because people really don't know what to say,
Yeah,
but it was just, "Oh, I know how you feel." I didn't like that.
yeah,
So that was always I don't know, just I feel like there's something better that could have been said, so,
yeah,
yeah.
yeah. You're like, Do you really?" Like,
I
uh,
know, like, "Do you?" Yeah. So
that's
but
exactly
other than that,
my
no, it
thought.
was just the other triggers I said, that was really it. Just like, "When are you gonna have kids? Or are you,
Yeah,
still looking pregnant?" Like, that whole thing, it was difficult to navigate that also, so
yeah.
just the comments people would say.
It's always surprising. You're like, "Huh, interesting. No, wouldn't have said that."
Mhm.
I've learned something.
Right.
I've definitely
Yeah.
learned some things. Um,
Mhm.
and I'm curious what you did with and maybe you can speak to this professionally as well, is that you mentioned, your milk coming in and how brutal that was, because I felt the same
Mhm.
way. That was so difficult. Do you, was there anything that you did to suppress your milk or and
I
also
didn't,
you didn't.
I'm
Okay, you
sorry.
didn't. Yeah, go ahead.
No, because I had never tried to suppress it before, and so nobody told me, "Oh, like, cabbage leaves would work in your bra." I
Yeah.
didn't know that. The biggest thing I knew was don't stimulate them, like, just let
Yeah.
them be, it'll eventually go down. And
Yeah.
so that's what I did. I just wore a tight sports bra, tried not to touch them, and
Yeah.
just waited for it to go away. It was awful, but
Yeah. It
eventually
re
it did, so,
yeah. It is
yeah.
awful. It's so hard. And professionally speaking, do you prep some of those ladies that have had a loss? Do you let them know that that's gonna be something that they have to deal with and give them some tips and everything?
I do. I always try to tell them about that, for sure, because it's like the last thing you think of, really,
Mhm.
until you wake up and you're like, "Oh, I forgot that that's still going to happen."
Yeah.
And then I also always try to tell them about when you go home and you see the nursery that you set up for your baby. It's going to be really difficult to look at that, but it's also going to be very hard to just leave the hospital and go back home and try to navigate life when it's supposed to feel so normal and it's not. Like, it's going to be hard at first. If you need to just shut that door, don't look in the nursery until you feel like you're
Yeah.
strong enough to. There's nothing wrong with that. It's just so hard once you get home, especially if you have other children, and it's like, how am I supposed to feel normal and function like a normal
Yeah.
person when all
Things
these
are
things are going on? It's just,
yeah.
you can never, there's nothing anybody could say, even myself, that can prepare you for what you're going to face when you get home.
Yeah.
it's it's hard. I try, but nothing will prepare you because everyone's going to respond so differently.
Right. But just even a word of warning slash permission to just, like you said, close the door if you need to and not deal with it for a minute. I think that's some
Yeah,
really
and to feel what you feel. There's nothing wrong with what you feel. It's going to
yeah,
come in waves. you
yeah,
know Grief has so many different phases, with just acceptance and grief and anger, like, all of that. There's so
yeah,
many phases of it all, so
yeah,
it's all
exactly.
normal.
It's
Mhm.
all normal. It's all normal. It stinks. You have to go through
Yeah.
it. uh,
Yes. Yes.
Well, Sarah, thank you so much for this wonderful discussion. It's been so enlightening to see your point of view as a mom and a mom of loss, and then also somebody that works in L&D and giving that perspective. I think it is extremely valuable, and I do think that Landon's little life is so powerful because it's affected you and what you do, what your husband seems to do because of him,
Mhm.
and what a blessing that he has been to you guys.
Definitely. in such a strange way, but yeah, it's a blessing
Yes,
for
and
sure.
yeah, that's and, I just wanted to ask you if there was any last, advice or anything that you wanted to share with us about Landon before we finish up today.
I think just again, just allow yourself to feel what you feel. Don't if it's in your heart to try for children again, go for it. Don't be afraid of whatever happened the first time repeating itself. Don't let that fear hold you back from hopefully completing your family and getting what you want. And then just find some way to honor the child that you lost. It could be something small. It doesn't have to be anything huge at all, but something that honors your child that can help you heal and move on as well. Like a garden or honoring their birthday or something to that effect, I think is pretty impactful. So
Yeah, wonderful. Thank you so much. That was perfect. That was a great way to end it, and
thank
thank you again, Sarah, for
you
your
so much for having me.
yeah, you're welcome.
All right. Take care. Thank you so much.